I'm Sandy Estrada, and I'm an infectious diseases clinical pharmacist. When I first entered healthcare, I wasn't really aware of the problem that Candida infections could cause patients. Many times we don't recognize that they have this type of infection soon enough, and due to that, there are high mortality rates associated with that type of infection. Blood cultures for the detection of invasive candidiasis are only about 50% sensitive. The advice I would have for a hospital that has a lot of patients with high risk for invasive candidiasis, but not seeing a lot of positive blood cultures, that they may be in fact missing some of their patients and not realizing that. When I first heard there was a rapid sepsis diagnostic within 3 to 5 hours, I was impressed. Over the last 5 years or so, we've been working with rapid diagnostics in our health system. However, most of these have still taken 24 to 48 hours to get results. So bringing that down to 3 to 5 hours was really a new innovation that we haven't seen before. We chose to implement the T2Candida panel because we investigated the current treatment of candidemia at our healthcare system, and we realized that the costs associated as well as the mortality associated with Candida was higher than we had realized. And we felt that the ability to diagnose these infections in 3 to 5 hours would make a significant impact on our patient care. One example where we've seen a big impact was a patient who had come in as a trauma and had been having low-grade fevers for several days while in the hospital. This patient, they were not on empiric antifungals because we did not have a high suspicion for a fungal infection, but wanted to check. When the T2Candida did come back positive in this patient, then we were able to get an antifungal started within about 6 hours of ordering the test. We were able to catch it before it developed into potentially a more severe fungal osteomyelitis that may have resulted in readmission. The impact of the T2Candida assay on the lives of our patients can really be approached from 2 different standpoints. So the first would be the patients with a positive T2 result. We've been able to see a reduction in the time it takes to initiate appropriate antifungal therapy from about 39 hours to about 5 hours. On the other side, in the patients with a negative result, being able to reduce the days of therapy for antifungals from 9 days down to 2 days. That's resulted in about a $50,000 reduction in antifungal utilization. When we break it down to the specific patient level and take into consideration the cost of the T2 assay, then we see about a $295 cost reduction on the individual patient level. Prior to having rapid diagnostics available, in many cases it takes 3 to 5 days to diagnose what type of infection a patient has. Now with the advent of rapid diagnostics, in many cases we can cut that time down to 24 hours or less, which allows us to choose a more appropriate narrow spectrum agent to treat the patient with, and perhaps also have less toxicity, less cost, and other collateral damage from antimicrobial use.